Hi, I'm Donna Edwards, and in today's presentation we will be discussing After Incarceration, a guide to helping women re-enter the community. Identify critical reentry. Women's needs during reentry can be different from men's due to different experiences and relative access to critical resources. Example given, a history of abuse, poverty, substance abuse, family support, dependent children. Prior to a woman's release from prison or jail, individuals working with her should assess her needs, and develop a reentry plan to ensure that the following are identified and ready to assist with the transition: community-based mental health and substance use treatment providers, healthcare coverage providers, example given, Medicaid, housing and other social supports, and advocacy organizations. An effective reentry plan should be strength-based, trauma-informed, and individualized. Effective reentry services for women should address needs based on the gender-specific issues involved when women interface with the justice system. Based on the guiding framework set forth in this document, the following critical needs should be discussed and included in the reentry planning process. The pathways that should be discussed is housing providing distance from prior abusive relationships, transportation, clothing, income and employment, often to support children, single-parent households, identification, example given, getting their social security card, birth certificates, and government ID, and education. Racial and ethical factors. Past and potential present systemic barriers or disparate treatment of women based on racial and ethical differences should be considered when providing assistance across all critical areas of need. Programming that meets the needs of women of a specific race, ethnicity, or culture can lead to improvement outcomes compared to programs created for the general population or the dominant culture of that community. For example, the Diane Wade House provides Afrocentric transitional programming for women reentering the community, increasing their participants' access to culturally specific treatments and services. Relational, legal support including obtaining or maintaining child custody. Family reunification, including parenting education and planning to resume custody and care of minor children. Domestic violence or intimate partner violence interventions, and child care. Trauma and addiction. Mental health care or trauma-related symptomatology, substance use disorder treatment, history of sex work trafficking, primary health concerns including pregnancy or gynecologic health, and weight gain associated with incarceration, reproductive health care, prenatal care, and treatment for sexually transmitted diseases. Safe and stable housing is particularly important for women to ensure their physical and emotional safety immediately following release. Having a secure place to live can minimize the risk of women returning to sex work or relying on unhealthy relationships to meet basic needs. Safe and stable housing should be located away from primary abusive or unhealthy relationships with space for the women to make her transition back into the community a positive and productive experience. A woman's criminal history can make it difficult to find appropriate housing, as many communities lack sufficient housing options for people with a criminal conviction. Some communities may have transitional housing or halfway houses for women. However, not all jurisdictions certify or regulate these programs. Housing programs should be vetted to ensure they do not engage in predatory practices, such as requiring significant portions of a woman's disability check if she receives disability benefits, or a paycheck, or forcing program participants to engage in inappropriate or illegal behaviors or labor, example giving, panhandling, prostitution, to generate income for the program. Employment is crucial for women in meeting their needs and building their independence. Making a livable wage is critical to ensuring that temptations to resume unhealthy relationships for financial reasons or engaging in unhealthy or illegal behaviors to earn income are minimized. However, having a criminal history can be a major barrier to employment. Women should be supportive in finding and retaining employment. This may include providing women help finding organizations that are receptive to hiring individuals with criminal histories, overcoming barriers to obtaining an interview, accessing clothes that are appropriate for interviews, securing transportation to interviews and employment when hired, arranging childcare during working hours, reconciling work schedules with requirements for any criminal justice oversight, such as probation visits, and addressing other needs that arise. More information and resources. SAMHSA's Treatment Access page, National Resource Center on Justice-Involved Women, National Resource Center on Children and Families of the Incarcerated, the Directory of Programs for Women with Criminal Justice Involvement, Reentry Considerations for Justice Involvement Women, Reentry Resources when victims of battering return to the community after jail or prison, Reentry Tip Sheets for Women including fillable worksheets, the Jewish Vocational Services Women Offender Reentry Collaboration, a practitioner's blueprint for replication. Addressing substance use disorders. Substance use disorders, SUDs, are common among incarcerated women. Though current national rates of SUDs are higher in men than they are in women, this gap is decreasing. In addition, women's substance use patterns and outcomes differ from those of men. For example, managing SUDs during pregnancy is a medical concern unique to women. Women are also most likely to have a co-occurring mental health diagnosis than men are. Further, women face considerable gender-specific barriers to accessing addiction treatment compared to men, including pregnancy, the need for childcare, and sexual harassment. Opioid misuse is currently a major concern in the United States, and in recent years there has been an increase in the number of females using opiates. Between 2000 and 2014, the number of deaths due to opiate overdose in the United States increased by 200%. The opiate epidemic has impacted the criminal justice system with a higher rate of opiate use among incarcerated individuals than among the general population. This fact has particularly serious impacts for women, who are more likely than men to experience overdose and death related to opiate use after release. It is important to connect clients with substance use treatment and services during and after incarceration to support their continued engagement. If women are engaged in substance use treatment programs while incarcerated, efforts should be made to help them continue to utilize these services when they re-enter the community. This might include having contact with the same treatment provider post-release, receiving services within 24 to 72 hours after release, and receiving long-term follow-up. A number of treatment approaches have been found to be effective or promising among justice-involved women. Medication-assisted treatment, MAT, is an evidence-based practice for treating opiate and alcohol use disorders. MAT is considered a best practice for treating pregnant women. A range of cognitive behavioral therapies show effectiveness related between promising and proven in reducing substance use disorders. These therapies may include motivational interviewing and contingency management, among others. Harm reduction is not a specific treatment, but a general approach to substance use intervention. Harm reduction focuses on reducing the consequences of substance use and recognizing the nonlinear process of recovery during substance use treatment. Other potential barriers should be addressed in reentering women with substance use disorders. For instance, providing child care and transportation options can increase participation and retention in substance use treatment programs. Assessing the woman's relationship with loved ones who are also experiencing substance use disorders is key to understanding who is available in the women's network that supports recovery and what relationships may need to be considered with caution or served during the transition back into the community. Understanding the woman's ability to pay for treatment is also critical. Women re-entering the community may be eligible for Medicaid coverage, particularly if any of them are mothers. With custody of their children. If they are not eligible for Medicaid, it will be important to help women navigate options for obtaining health insurance or conversions with their treatment providers to see if they are able to change for services using a sliding scale, arrange an achievable payment plan, or provide some other subsidized means for accessing treatment at a manageable rate. Connect to mental health care services. Incarcerated women have higher rates of mental disorders than non-incarcerated women and incarcerated men do, and they often have complex treatment needs due to co-occurring mental use or substance use disorders, other types of chronic health disorders. Trauma is common among women in the criminal justice system. Provide trauma-informed services. Traumatic events can have significant consequences for an individual's mental and behavioral health. For example, experiences of trauma have been associated with depression, anxiety, and substance use disorders. Reentry is a stressful time and can be especially difficult for women with mental health needs. One study showed that they may experience poorer health conditions, more frequent hospitalizations, and a greater frequency of suicidal thoughts compared to reentering women without mental illness. The following information provides helpful ways to increase support during this period of transition. Screening and assessments. Women with mental disorders may have received assessments, services, or treatment during previous phases in their justice involvement. If at all possible, previous assessments and records should be obtained and worked into the reentry planning process to ensure continuity of care as the woman moves from the justice system setting back into the community. If no assessments or treatment have been provided, the reentry planning process should include screenings to ensure further assessments are not merited. If screening tools are needed, SAMHSA's screening and assessment of co-occurring disorders in the justice system provides a number of recommendations for screenings that can provide insight into possible mental illness, substance use disorders, and trauma. Reentry planning. If the woman has a previously identified mental disorder, her optional reentry plan would include a scheduled appointment at a mental health treatment provider occurring as soon as possible after release. In addition, be sure that medical records from the correctional facility are shared with the community-based provider. This can ensure that critical services and medications are provided accurately and in a timely manner. Having a scheduled appointment is proven to be more effective than simply referring a person to an agency. If transportation supports are available, leverage those services to ensure that the woman is able to reach the provider agency. Women reentering the community should be involved in determining the most appropriate treatment provider for follow-up services. Research shows that people of color may have difficulty obtaining appointments or finding a provider that delivers culturally responsive mental health treatment. There are many religious and cultural considerations that women want to take into account when choosing a provider. Involving the reentry woman in the decision-making process enables her to begin taking ownership of her own healing and recovery. Women with mental illness are found to have greater difficulties meeting their critical needs during the year following their release compared to women without mental illness, including significant challenges in obtaining housing, employment, and financial support from families. This should be taken into account when helping a woman consider and addresses her critical reentry needs. Extra effort may be needed to identify transitional housing that is supportive of women with mental illness, as well as supported employment programs that focus on helping people with mental illness become gainfully employed. Women with mental illness may benefit from additional guidance in developing healthy connections with formal and informal supports as part of a recovery-oriented community. Other critical supports. If an appointment with a mental health provider is not immediately available after release, ensure the woman is able to obtain sufficient amounts of any prescribed medication to last until the scheduled appointment. Ideally, the correctional facility will provide medications upon release. However, it may be still necessary to obtain a written prescription refill if the amount of medication provided might not last until the scheduled appointment. If a written prescription refill is not provided, it may be necessary to contact the correctional facility for that paperwork to maintain medical access until the woman is able to see the community-based provider. Where possible, link reentering women with peer support specialists who have lived experience of mental health and justice involvement and who can provide another level of support and guidance as the woman begins to work on her reentry plan and transition into the community. Address physical and reproductive health care. Incarcerated individuals have higher rates of sexually transmitted diseases than non-incarcerated individuals do, and the prevalence of hepatitis C among currently or formerly incarcerated individuals is high. Incarcerated women are at an especially high risk of STDs and HIV, often due to engagement in transsexual sex. Pregnancy should also be addressed during and after incarceration. About 75% of women in jails and prisons are at the childbearing age. Although a comprehensive national count of incarcerated pregnant women does not exist, estimates indicate that over 3% of women entering prisons are pregnant, and about 6 to 10% of women in local jails are pregnant. Women's access to health care within jails and prisons varies and is often limited. Many individuals do not receive adequate health care while they are incarcerated, and upon reentry, women often experience additional barriers with quality health care. One study showed that women leaving jail or prisons under community correction supervision were more likely to use emergency department or experience hospitalization than were men under community correction supervision in the general population. This points to the critical need to link women with health care coverage or insurance. If working with a woman who may qualify for Medicaid, begin the necessary paperwork to initiate or reinstate enrollment in the state Medicaid program prior to her release whenever possible. The paperwork should be started prior to release so that it may be submitted and coverage initiated as promptly and practicable following release. Women with custody upon release of children who are minors should be considered for Medicaid eligibility. If the woman has disabilities and qualifies for Social Security disability insurance, check to see if it is automatically eligible for Medicaid coverage as well. If working with a woman who may not qualify for Medicaid, federally funded health centers and community-based centers that charge fees based on a sliding scale may provide affordable services to address a number of different health needs. The reentry process is an opportunity to provide women with essential health care services. Their needs will likely differ depending on a woman's health conditions or childbearing status. Providing long-acting reversible contraceptive services to incarcerated women prior to reentry helps them avoid common barriers to contraceptive care in the community. This can allow them to focus on other aspects of reentry without having to worry about the unintended pregnancy. Recommendations for contraceptive services are as follows. Offer contraceptives in a non-coercive manner prior to reentry to help women avoid unintended pregnancies. Ensure women understand their choice to receive or not receive contraception. Provide education on contraceptive methods and services. Consider long-acting reversible contraceptives such as the IUDs and implants, which can last several years without follow-up. Pregnant women reentering the community might face additional stressors related to their reproductive health care. Recommendations working with pregnant women during reentry include the following. Identify, educate about, and link the agencies providing comprehensive reproductive health care services. Link the substance use disorder treatment, provide education on safe use of pharmacological therapy for substance use treatment during pregnancy. Link to mental health treatments with particular attention paid to anxiety and perinatal depression disorders. Provide education on the safe use of pharmacotherapy for mental illness during pregnancy. Engage clients in parent or maternity counseling and classes. Provide culturally competent services. Individual or community culture, there are many racial, ethnic, and social economic inequalities that affect justice-involved people throughout the United States. Consequently, culturally competent practices are critical when working with formerly incarcerated women. Cultural competence refers to a set of congruent behaviors, attitudes, and policies that come together in a system, agencies, or among professionals that enables effective work in cross-cultural situations. Culturally competent behaviors is respectful and responsive to the different beliefs, practices, and needs of diverse populations. Both individuals and organizations might need to tailor services to respond to the specific cultures of their clients. The culture of an individual or community may be defined by factors such as race, ethnicity, gender identity, age, sexual orientation, disability, income level, educational level, etc. It is important to consider the language, thoughts, customs, beliefs, and values associated with different groups to keep in mind that people with the same cultural identities will not share all of the same beliefs and values. It is also worth noting that cultural identities and the customs, beliefs, and values that inform those identities can change over time. Individuals who are part or more than one group, such as being both African American and female, may experience amplified effects of disparate treatment or systemic inequality. This phenomenon is formally known as intersectionality. This combination of negative effects can seriously hinder a woman in her efforts to successfully transition back to the community. Intersectionality should be taken into consideration when providing culturally competent services to ensure that all of the barriers faced by reentering women are understood and that sufficient supports are put into place to enable her successful reentry. Institutional culture. Research suggests that the culture associated with incarceration can influence clients' general functioning during and after incarceration. Jail and prison environments and staff, institutional and community-led programs, security concerns, rigid schedules, and the use of solitary confinement all shape the culture of correctional facilities and can have a lasting impact on a woman's perceptions of safety, time management, and relationships with authority figures. Some researchers recommend that prison culture be included in a culturally competent framework for addressing reentry and other needs of individuals who have experienced incarceration. Culturally competent practices. Research has found that culturally competent practices are associated with improved provider-patient communication, better treatment adherence, and better patient rating of care. For these reasons, individuals and organizations who work with formerly incarcerated women should take steps to ensure they are engaging culturally competent practices. Provide trauma-informed services. Trauma-informed services recognize that trauma plays a role in justice involvement. Trauma is common among women in the criminal justice system, with an estimated of 96% of women reporting at least one traumatic event in their lifetime, and may have experienced an average of 6 different traumatic events. Although traumatic experience can affect both men and women involved in the justice system, women experience trauma at a higher rate than men do and also more often experience negative consequences of trauma. Example given, post-traumatic stress disorder. You must be knowledgeable. Provide training and education on trauma and women. Promote trauma awareness and understanding. Recognize that trauma-related symptoms and behavior originate from adapting to traumatic experiences. Foster trauma-resistant skills. Shape services accordingly. Minimize the risk of re-traumatizing or replicating prior trauma dynamics. Create a safe physical environment. Incorporate universal routine screenings for trauma. Familiarize the clients with a trauma-informed service. Identify recovery from trauma as a primary goal. Establish healthy relationships. Understand trauma in the context of individual environments. View trauma through a social cultural lens. Create collaborative relationships and participation opportunities. Use a strengths-focused perspective and promote resilience. Support control, choice, and autonomy. Provide hope and empathize that recovery is possible. Addressing triggers is another important component of providing trauma-informed services. A trigger is a stimulant. Example given, the situation, the person, objective, or circumstance that reminds an individual of past trauma. Triggers can cause uncomfortable memories, feelings, and physical symptoms. These memories can also result in flashbacks or feelings of re-experiencing a past traumatic event. Because there are other symptoms of trauma may be barriers to the successful navigation of an everyday task and situation, learning to cope with this trauma is particularly important for individuals who are managing trauma of reentry. For a better understanding of how to apply these principles of trauma-informed care into reaction with women reentering their communities, find a local trainer to provide trauma training for criminal justice professionals or request a training session. Physical settings. Trauma-informed, gender-responsive programs use spaces that are designed to create a warm and inviting physical setting where a woman can feel safe. Ways to ensure a space is trauma-responsive include the following: keep doors open, use adequate lighting, offer various seating options so that women can face the door if preferred, have a woman provider and/or women-only groups available, offer childcare options when possible, provide access to a certified peer specialist. Building healthy, trusting relationships. Common relational risk and needs. It is important for providers who work with formerly incarcerated women to build healthy, trusting relationships with them and encourage honest communication. Many women reentering the community benefit from positive parental and peer relationships. However, recently incarcerated women commonly reconnect with partners who provide social or financial support but may also enable risky behaviors, such as using substances. This dynamic can make women particularly vulnerable when attempting to follow a reentry plan and succeed in their transition from incarceration back into the community. Education and treatment addressing personal and family relationships may be a critical piece of a woman's reentry plan, particularly if the unhealthy dynamics of a previous relationship with peers, family, or a loved one played a part in her criminal justice involvement. Local social service agencies or behavioral health providers may be able to provide recommendations for effective family or personal therapy and educational opportunities. Professional relationships to build trust. Through a professional relationship with the client, it may also be possible to model and build skills. Trusting relationships encourage women to ask for help when they need it. Unfortunately, many former incarcerated women have difficulty trusting others due to the experiences of incarceration, trauma, and a dysfunctional relationship. A general lack of trust among women who have experienced incarceration can make it difficult for their providers to keep established, effective therapeutic relationships with them. Service providers should focus on developing rapport with their clients to ensure clients feel comfortable in a professional relationship. Rapport often helps build trust in newly formed professional relationships. It is also important that the providers set boundaries with their clients. Clients might ask for help beyond the scope of an individual's professional responsibilities, or providers might personally identify with their clients and overstep their boundaries or professional duties to help. Violating boundaries, even if done with good intentions, will negatively affect the professional provider-client relationship. Appropriate training should be provided to individuals who work with justice-involved women to support professional efforts to maintain appropriate and supportive relationships with their clients. One method for helping to keep women engaged in the provider-client relationship is motivational interviewing. Motivational interviewing performed in a trauma-informed manner can promote collaboration, allow clients to make their own choices about care, and foster self-efficacy. Motivational interviewing can be an effective trust-building tool for individuals who work with incarcerated or formerly incarcerated women. Reestablish family relationships. Reestablishing family relationships is an important factor to addressing the reentry process. Approximately 65,600 women in federal and state custody, 62% report being the mothers of 147,400 minor-aged children by the most recent estimate. Of these mothers, 77% stated that they provided most or the daily care of their children before incarceration. 11% of the incarcerated women reported that their children were placed in foster care, compared to only 2% of incarcerated fathers. About 42% of mothers in state prisons identified as being a single-parent household in the month prior to arrest, compared to 17% of fathers. In 2017, incarcerated accounted for 7% of the parental rights terminated circumstances. The effects of maternal incarceration on children. The children of the incarcerated mothers have significant impact on the child's physical and emotional well-being. Children might have experienced behavioral and mental health issues, poor school performance, and financial hardship while their mother is incarcerated. Although these effects vary, helping families repair and maintain mother-child relationships during and after incarceration is important for children regardless of their living situation. Example given: foster care, living with another parent, living with grandparents or other family members, and kinship care. Women who have given birth while incarcerated have additional family reunification needs, particularly if the jail or prisons do not have programs in place to allow the child to remain with the mother after birth. In most states, women who are separated from their babies within 48 to 72 hours and have limited time to bond and establish a relationship with their child during incarceration. The mother-infant relationship is a critical part of healthy child development. When this relationship is disrupted, the infant is at risk of developing insecure and/or disorganized attachment styles, both of which are linked to poor developmental outcomes. Facilitating reunification has benefits for the child, the mother, and the entire family. Certain state and federal policies may separate mothers from their children due to incarceration. For example, the Adoption of Safe Families Act calls for states to terminate parental rights for children who have been in foster care 15 of the last 22 months. Accordingly, if the child is in foster care for more than 15 months while their mother is incarcerated, their mother may lose parental rights. Although incarceration is not explicitly listed as the cause for termination, it is a risk that can make the reunification process more complex. This is an obstacle women might face during the reentry process. Strategies to reestablish family relationships. Women who stay engaged with their families during incarceration generally see more positive outcomes than those who do not, such as increased resiliency among children, reduced family justice involvement, and lowered risk of substance use and other risky behaviors. In some cases, it might not be appropriate for reentering mothers and their children to live together after release. In these situations, the proper agency should work with the mothers to plan for visits and take steps towards reunification as appropriate. Regardless of the living situation, agencies and individuals working with reentering mothers should ensure they are linked with evidence-based parenting classes and family reunification supports. Ensure mothers have appropriate social support to effectively parent. Provide legal support regarding child custody concerns. Engage mothers in family therapy and parenting education if needed. Facilitate family reunification upon reentry. Parenting skills and education. An effective reentry plan for mothers should facilitate participation in parenting classes. Parenting classes, content, and formats vary depending on the focus of each class. Programs that emphasize emotional communication, positive interaction, and disciplinary consistency have been shown to improve both parental outcomes and children's behavior outcomes. Facilitate payment of justice system fines and fees. Incarcerated individuals are often required to pay fines and fees related to their crimes, pretrial detention fees, court filing fees, and costs associated with conviction process. Example given, fingerprinting, public defender's fees, and probation or parole fees. Failure to pay fines or restitution, no matter how small in dollar amount, can result in reincarceration. Women in particular are at risk for financial instability prior to incarceration post-release. Regardless of incarceration status, women often have less financial literacy than men have. Additionally, justice involvement women have very high rates of domestic violence exposure, which can affect their access to important financial information. Example given, their partner did not allow them to access to their information. Finally, there is evidence that women often engage in criminal behavior that is directly related to generating income. Example given, prostitution or drug offense. Helping women navigate justice system costs can reduce the likelihood of financial-driven recidivism. Family members of incarcerated women might also be financially burdened. In addition to legal fees, family members face costs related to prison phone calls, video or in-person visitations, and commissary purchases. This can be a hardship, especially if a woman's incarceration led to the loss of a household income. Reentry costs for the family members of the incarcerated women can also be significant financial burdens. Example giving, sharing or providing housing, covering utilities or cell phone expenses, and more. Several concrete strategies can help previously incarcerated women manage these debts. Ask the debtor to provide information about the fines, fees. Ask the courts to help develop a repayment plan. Ask the courts to consider waiving fines, fees, and costs for indigent women and families. Obtain written documentation of the debt. Help write out a payment plan to provide a sense of control over the repayment process. Individuals who assist women with crime-related debt should also be aware of the local initiatives and advocacy groups working to reduce the financial burden and consequences associated with the crime-related debt. Increase self-efficacy through certified peer specialists. Self-efficacy refers to an individual's beliefs that they can effectively complete tasks to produce desired outcomes. People with a higher level of self-efficacy manage challenges more effectively than those with lower levels. Low self-efficacy is associated with negative outcomes such as criminal activity and recidivism. Helping clients build self-efficacy upon reentry is important. Unfortunately, many incarcerated women have had negative experiences. Example given, trauma or financial burdens that reduce their sense of self-efficacy. The correctional system can also trigger feelings of inadequacy among justice-involved women, given their lack of power and control. That said, when administered effectively, the reentry process provides an opportunity for women to increase their self-efficacy and empowerment. Trauma-informed systems can have been shown to increase self-efficacy in justice-involved women. Women might find it especially helpful to engage in psychotherapy to increase their feelings of self-confidence and advocacy. Professionals should consider using peer support services to assist in building their clients' self-efficacy. Peer-based recovery support services use the knowledge and the skills of individuals who lived experiences. Example given, substance use, mental illness, and incarcerations help to initiate support and maintain the recovery of others. Although there are many models of peer support, certified peer support specialists are individuals with lived experiences who have completed a formal training and certification process to provide peer support services. In accordance with the best practices, women peer support specialists should be assigned to women reentering the community to avoid potential trauma triggers, support healthy relationships, and provide an efficient peer-to-peer experience. The role of peer specialists varies considerably depending on the situation. Roles can include providing social support, encouragement, addressing hopelessness, communicating with providers, managing illnesses, addressing stigma in the community, transportation, support navigating the reentry process, etc. In addition to providing support, peer support services often help reduce individual and system-level barriers to treatment, including the lack of professional resources, stigma, lack of treatment engagement, social isolation, and difficulty navigating complex systems. Example given, healthcare or criminal justice. The use of peer specialists have been linked with a variety of positive outcomes, including the following: increased engagement in treatment, increased stability, fewer psychiatric hospitalizations, improved quality of life, increased hope for recovery, improved substance use disorder outcomes. These outcomes can be connected to the theoretical framework of women-specific reentry needs. Traditionally, peer-based support services have focused on individuals with mental or substance use disorders, but more recently, peer support services have been extended to people with justice involvement. Although this approach is relatively new, there is evidence that peer specialists with justice experience can improve quality of life ratings for their clients, specifically among formerly incarcerated women. Additionally, forensic peers are viewed to pro-social role models by their clients. Finally, there is evidence that peer specialists themselves enjoy higher levels of life satisfaction and self-esteem in their helping role, and that they utilize their role to form new pro-social identities. In conclusion, as the prevalence of reentry services and programs increases across the United States, it is important that these efforts be shaped to maximize the investment of funds, staff time, and resources to ensure optimal results for women returning to their communities. By comprehensively addressing issues that emerge from a woman's pathway into the criminal justice system, racial and ethical disparities, relational approaches, trauma, and substance use disorders, individuals providing reentry services may be confident that their work will positively impact the women they serve along with their children and families.